My name is Say, and I'm presenting on behalf of the Ghana team. So our project is a retrospective look in what has happened already. So we are seeking to document lessons from the integrated Oral Polio Virus 2 and vitamin A supplementation campaign in the context of COVID-19 pandemic in Ghana. So why are we interested in doing this project? Like all other countries, Ghana also has suffered from the COVID-19. And with COVID-19, Ghana has experienced a reduction in the uptake of health and nutrition interventions, namely OPD. So reason why we did the collaborative campaign planning was that COVID has had a toll on some of the health indices in Ghana, especially outpatient attendance that dropped in March. Immediately the COVID cases started going up. There's also evidence, this is from analysis from the routine data, evidence that about 32,000 children were left unvaccinated in the first quarter of 2020. And vitamin A coverage for the period half year also was lower than that of the previous year, which was about 35%. And so earlier on in 2019 also, there had suspected cases of circulating vaccine-derived polio virus 2 had been identified. And so there were efforts to work on that one and stop its transmission. Given the situation with the virus that had been identified and the low uptake of services due to COVID, the collaborative campaign planning became necessary to save cost, time, and reach more people with several health and nutrition interventions within a short time. And also this was brought together the health and nutrition interventions that are delivered by the same cadre of health workers and the targets the same beneficiaries and accelerates their uptake in the context that we were in. So vitamin A supplementation, because the coverage had gone down, and oral polio vaccine type 2 campaigns were integrated to interrupt outbreak of circulation and also to increase vitamin A coverage. This was done in 8 of the 16 regions in Ghana, about 179 districts in total. So there were 3 main questions for this campaign, or for this case study that we want to do, even though the campaign has already happened. In documenting the lessons, we want to answer 3 main questions. How do we improve the quality of future integrated health campaigns? For that specifically, we want to know what worked well, what did not work well, and what are the reasons. So what were the lessons learned from the planning preparation to the campaign implementation? Secondly, we want to find out how do we reach all the children with several health and nutrition interventions, because in the report, some of the children were not reached. And so how many children were left out? We need to determine that. Why and how could they be reached? Why were the messages and strategies for social mobilization successful, and what could be improved? And what is the appropriate time or approach to reach all children? The third question is, what are the efficiency gains made due to the integrated approach to the campaign? So the objective here is to maximize resources and get higher value for money. So determine the cost, human resource, transport, etc. And also determine what were the missed opportunities. So to elicit information for these questions that we want to answer, basically we are going to use 2 approaches or methods. We're going to review sundry reports that have been produced by the campaign, from planning to implementation to monitoring and all. And then also do some key informant interviews. And we're targeting all those who were part of the process. So program managers, partners, sponsors, health workers who implemented it, and all other stakeholders who supported the process in a way. So the stakeholders that were involved in this campaign are several, and we have grouped them as you see on the screen. For the government side, Ministry of Health, the Ghana Health Service, District Assembly, that's at the local level, the Ministry of Children, Gender and Social Protection, Ministry of Information, and they all played complementary roles for the implementation of the campaign. There's also the donor partners, the UN agencies and other partners, UNICEF, WHO, and CDC, who provided technical support, logistical support, monitoring, data management, several roles. There's also the civil society organizations that were part of the implementation, supported in community mobilization, logistics, and etc. So that at the health program levels, they led the coordination, implementation, and all the planning. So what were the enabling factors, or what are the enabling factors that supported the campaign? The two campaigns that were put together were targeting the same beneficiaries. They were using the same health workers. So this was an opportunity that supported or facilitated the collaboration. There's also the issue of existing mechanisms for intersectoral collaboration. So already in the country, there are structures that support the provision of immunization services. Example is the EPI leadership and coordination chaired by the Director of Public Health of the Ghana Health Service. And this comprises representatives that I listed earlier in the earlier slide, and they provide coordination, support, logistics support. Basically, they support the planning of immunization activities. And there's also the Micronutrient Task Force for Nutrition, similar rules, oversight responsibility, and this committee has oversight responsibility on all the subcommittees that supported the campaign. So the subcommittees were several, included the National Planning and Coordination, Communication and Social Mobilization, Training, cascaded training from national level to the very periphery, vaccines and logistics, monitoring and evaluation, and safety monitoring. So all these stakeholders played an important role. So the existing mechanisms was useful, and also the complementary roles of all the various stakeholders. Hindering factors, a few are listed here, but there are more, but we focus on these three. Limited funding to execute the integrated campaign because of COVID, and also the added cost of making sure that those doing the campaign are properly protected. Coordination challenges due to inability to meet face-to-face due to COVID. And then generally the low awareness of an integrated service. There was also the issue of the weather, rainfall, and all that. So approaches to foster collaboration and also build from enablers and addresses. Like I said, the campaign leveraged on scarce financial resources for the two campaigns. So putting it all together maximized the resources that were available. Also formation of working groups and subcommittees, which were activated because of the collaboration, such as, I mentioned them already, the logistics, social mobilization, and all that. One other thing that we want to highlight is the harmonization and alignment of field tools. So instead of the two campaigns have various reporting forms and monitoring tools. So in this collaboration, it was harmonized and one tool was used for the field work. Joint training sessions for both volunteers and health workers. There's also the integrated messaging for social mobilization, and also leveraging on other logistics such as transport and to distribute campaign materials. These are the opportunities that were available. Another unique thing that we want to mention is the unique opportunity through this campaign to also carry out education on COVID-19, especially to allay fears um, about the perception that the oral polio vaccine and the vitamin A was a covered way of doing a COVID-19 trial. So the campaign gave the opportunity to allay those fears. So telling the story, we propose to use multiple approaches: traditional media, television, radio, when we have documented the story, online media channels, social media targeted at the general public, including influencers. So multiple channels. There's going to be also articles, press releases, depending on, so it will be targeted and using different approaches. Just to recap, ours is a retrospective review, and yeah, so campaign has already happened, but we want to learn lessons from it to inform future activities. Thank you very much.